All right, let's dive in. Today we're looking at obesity in Canada, but get this, we're using a report from Obesity Canada AND, a Reddit thread.
That's an interesting combo. Formal report versus like everyday opinion.
Exactly, and the report hits you right away with this number. $27.6 billion. The yearly cost if we do nothing about obesity.
Oh, yeah, that's a lot of money.
Yeah.
So it's a big deal economically, that's for sure. But before we go down that road, I think it's super important to understand how Obesity Canada is approaching this whole thing.
Yeah, they're not messing around. Right from the start, they're saying obesity is a chronic disease, not, just a lifestyle choice.
Yeah, no kidding. They're like straight up challenging that idea that it's all about being lazy or lacking willpower.
Right. Like, you just got to try harder, eat less, whatever.
Exactly. But they've got like scientific evidence backing them up. There's this quote from one of the report's authors, Dr. Ian Patton. He explains how our bodies have actually evolved to resist weight loss.
So it's like built in.
In a way, yeah. He talks about biological and genetic factors that affect our weight. Makes that whole eat less, move more thing a bit more complicated.
Definitely more to it than meets the eye.
Right. And this is where the idea of a set point comes in. It's pretty fascinating. Our bodies kind of have this predetermined weight range they try to stick to.
Like a thermostat, almost.
Exactly, like a thermostat for your weight. It's based on, your genes, hormones, even stuff from when you were a kid. And when you try to mess with that set point, your body pushes back.
By, like, changing your metabolism and stuff.
Yeah, your metabolism, how hungry you feel, even how many calories you burn when you exercise. It's wild.
So you could be working out, counting calories, and your body's like, nope, going back to the set point.
It can feel that way, yeah.
Yeah.
Explains why so many people yo-yo diet, lose weight, gain it back. Their body's trying to get back to where it thinks it should be.
That actually makes a lot of sense. It kind of blows that personal responsibility argument out of the water a little bit, don't you think?
For sure, it adds a whole other layer to the discussion. And speaking of different perspectives, let's bring in that Reddit thread. It's crazy how many different opinions are out there.
Oh, yeah. Tons of pushback against the whole obesity is a disease thing. A lot of people saying it's all about personal choices.
Right. You see that a lot.
There's this one comment I saw. It said, you can lose weight eating nothing but McDonald's every day as long as you stay under your calorie limit.
Interesting. What do you think about that?
Bold statement. I mean, there's the whole calorie thing, right? But it feels like they're missing the bigger picture.
Yeah. I mean, there's truth to the calorie thing.
Yeah.
You got to burn more than you eat to lose weight.
Yeah.
But it's not always that simple. We were just talking about all those other factors, biology, set points, the fact that it's hard for a lot of people to stay in a calorie deficit for a long time.
It's not as easy as just eat less.
Right. There's more to it.
Makes you think.
It does. And it's a good reminder that this whole issue is super complicated. There's not always one right answer.
Definitely food for thought. No pun intended.
Well, maybe a little pun intended. But seriously, this is where things get interesting. Because even if we talk about individual choices, there's another layer to consider. The impact of economics and social factors on obesity.
Totally. The report actually dives into the financial impact on individuals, not just the healthcare costs. It says people with obesity tend to earn less than those without.
It's true. And get this, the difference is even bigger for women. The report says women with obesity earn about 4% less than women in a healthy weight range.
4%. That's a big chunk of change. Why do you think that is?
It's probably a mix of things. Maybe bias at work, fewer job opportunities, or even just like physical limitations because of their weight. Certain jobs are harder if you have a certain body type.
Yeah. It's sad to think that someone's weight could affect their income like that.
Yeah, it's tough. And it can create this vicious cycle,
Yeah.
If you're struggling financially, you might not have access to healthy food or safe places to exercise, which of course can lead to more weight gain.
It's all connected. And a Reddit thread talked about this too, especially the cost of food and how that affects what people eat.
It's huge. Access to affordable, healthy food is a major part of this whole conversation.
I saw this one comment where someone compared the price of blueberries to a bag of chips. Guess which one was cheaper?
I think we can all guess that one.
Yeah, not the blueberries. And it makes you think eating healthy shouldn't be a luxury.
Exactly. It's not just about willpower. Sometimes it's about what you can afford. We need to make sure everyone has the chance to eat healthy, no matter how much money they make.
I totally agree.
So we've got personal choices, biology, and now economics all playing a part. This is getting complex, right?
It is, but it's also getting really interesting. We're starting to see all the different pieces of the puzzle. It's like, We hear all the time about taking personal responsibility for our health, but what about the environment we live in? Does that play a role? The Reddit thread actually had some pretty interesting thoughts about that. A lot of people were saying our surroundings can make it harder to stay at a healthy weight.
You're right. And that brings up this concept called the obesogenic environment. Basically, it means the world around us is kind of set up to make us gain weight.
Oh, interesting. So, like, what?
Well, think about it. We have all these jobs where you sit all day, fast food is everywhere, and we're constantly bombarded with ads for unhealthy stuff.
It's true. It's everywhere you look. It's like you're fighting an uphill battle. And the Reddit thread, they were talking about how this affects kids too, like all those fast food commercials aimed at them.
Yeah, it's definitely a concern. Kids are super impressionable, and when they see all these ads for sugary drinks and processed food, it can really shape their eating habits.
And didn't you mention before that there have been efforts to regulate that kind of advertising, but they often get shut down?
Yeah, there's been some pushback from industry groups. It's kind of a classic case of profits versus health.
Oh, no. It's frustrating. Do you think things will ever change?
I think it's important to stay hopeful. More and more people are becoming aware of how harmful junk food marketing can be, especially for kids. So hopefully that will lead to some real changes in policy.
It makes you wonder, is it on us then? Like waiting for the government or big companies to change things? Or can we do something ourselves?
Well, we can definitely make choices in our own lives that promote a healthier environment, like choosing to walk or bike instead of driving whenever you can.
Right, or even just being more aware of the food we buy.
Exactly. Every little bit helps. And we can also advocate for change in our communities,
Hmm.
support things that make it easier to be healthy, like walkable neighborhoods, more parks, healthier food options in schools and workplaces.
I like that. It's like taking action on a local level.
Right. And speaking of taking action, let's circle back to that food access issue. The Reddit thread had a lot to say about the cost of healthy food and what could be done about it.
Yeah, people were getting pretty passionate about that. There were some pretty strong opinions about government intervention. Like some people were talking about subsidies for healthy foods or even taxing unhealthy ones.
Yeah, like a sin tax on sugary drinks or processed foods, kind of like how cigarettes are taxed.
Interesting. I wonder if that would actually work. It would probably be super controversial.
Oh, for sure. Uh, It's a really complex issue. I mean, on the one hand, it could make healthy choices more affordable, which would be a good thing for public health. But then there's also the argument that it limits people's freedom to choose what they want to eat.
It's tricky, right?
Mm.
Finding that balance between public health and individual choice. Where do you stand on that?
I think it's important to look at both sides. We need to weigh the potential benefits for everyone's health against the potential drawbacks of the government getting involved in what people eat. Any decision should be based on facts
Mm.
and a real understanding of how complicated this issue is.
I think that's a good point. It's not always black and white, but I think one thing that's clear from both the Obesity Canada report, A&D, that Reddit thread, is there's no magic solution. It's going to take a lot of different approaches to tackle this.
Absolutely. We need to think bigger than just telling people to eat less, move more. We need to understand the biology, the environment, and the social and economic factors. It's all connected.
It's a lot to take in, but it's important stuff. And speaking of different approaches, the Reddit thread also brought up weight loss medications like Ozempic and Wegovy. There were some stories from people who had success with them, but also concerns about how much they cost and who has access to them.
Yeah, that's a topic that can be kind of controversial.
Hmm.
Those medications can be helpful for some people, but they're not a cure-all, and they don't work for everyone. It's important to talk to your doctor to figure out if they're right for you and to understand the risks and benefits.
One comment I saw, someone was joking about putting Ozempic in the water supply, like fluoride.
Oh, wow. That's a pretty bold statement.
Yeah, they were definitely making a point about affordability and access, but it does raise some ethical questions about, medical interventions on a large scale.
Right. It's a provocative thought, for sure. Obviously, no one's actually suggesting we do that, but it does highlight that we need more affordable treatment options for obesity. If we're really going to treat it like a chronic disease, people need access to care and support, just like they do for other chronic conditions.
So true. Which brings up another big question. What role does the healthcare system play in all of this? How can we make sure people with obesity are getting the support and treatment they need?
That's a tough one. There's no easy answer. But I think a good place to start is by changing how we think about it. Instead of blaming people or judging them, we need to approach this with understanding and support.
So less you need to lose weight and more. How can we help?
Exactly. We need a healthcare system that doesn't just focus on the symptoms, but also addresses the root causes and provides long-term support. That could mean making weight loss medications more affordable, offering more lifestyle counseling, and providing access to specialized care, like bariatric surgery when it's appropriate.
It sounds like we need a more holistic approach, something that takes into account the individual's whole situation.
Exactly. And it goes beyond just healthcare providers. We need to create a society that supports healthy choices and reduces the stigma around obesity.
It's about making people feel empowered to take control of their health without feeling judged or shamed.
Right. It's about creating an environment where everyone can thrive.
Wow, I feel like we've just scratched the surface here. We've talked about the science, the social stuff, economics, even the healthcare system. Where do we even go from here? How do we actually make a dent in this problem?
It can feel kind of overwhelming, right?
Yeah.
Like, where do you even start? But I think the important thing is to remember that small changes can make a difference. And one of the biggest things we can do is educate ourselves and talk to others about this.
It's true. This whole deep dive has been a real eye-opener for me. I'm already thinking about what I can do differently and how I talk about this with other people.
That's awesome. And as you keep learning about this, remember there are tons of resources out there. Like Obesity Canada, they have a lot of good info, and they're pushing for changes that can make things healthier for everyone.
I keep thinking about that Reddit thread too. It was wild to see all those different opinions and experiences, Not all of it was super helpful, but it definitely shows how important it is to talk about this stuff openly and honestly, even when it's hard.
Definitely. We need to get rid of the shame around obesity and make it okay for people to talk about their struggles and ask for help without feeling judged. And that starts with having those conversations, even when they're tough.
Yeah, realizing it's not just about willpower or making good choices. It's about understanding the science, the social stuff, and all the barriers that make it harder for some people.
Exactly. And once we get that, then we can start pushing for real change, supporting policies that, you know, promote healthy food, make healthcare more affordable, and address the economic stuff that contributes to this.
It's about shifting from blame to support, right?
Exactly. And remember, everyone has a part to play in making things healthier and fairer. Whether it's learning more, having those tough conversations, or pushing for change, every little bit counts.
So I guess the challenge for our listeners today is to take what they've learned and actually do something with it. Maybe start a conversation with a friend or family member about this, share something that surprised you, and maybe challenge some of those old ideas about weight and personal responsibility.
Yeah, and keep learning. The more we know about obesity, the better we can create a world where everyone has the chance to be healthy and happy.
Totally. Thanks for joining us for this deep dive, everyone. We hope you learned something new and interesting. And until next time, take care.